Crest Insurance Group is pleased to assist you with your Medicare choices. Medicare is a federal health insurance program for Americans aged 65 and older and for some younger people with certain disabilities. It's a crucial safety net, helping millions afford healthcare they might otherwise not get. Medicare covers doctor visits, hospital stays, and prescription drugs, reducing the financial burden of medical care. Without it, many seniors and disabled individuals would face overwhelming costs. Established in 1965, Medicare has evolved to meet changing healthcare needs. Today it remains a cornerstone of American healthcare. Understanding how Medicare works is essential for making smart health and financial decisions. In this guide, we'll break down Medicare's parts, eligibility, enrollment costs, and common mistakes. Our goal? Give you clear, practical information to help you get the most from your coverage. Knowing your options is the first step to protecting your health and your wallet. Let's get started and make sense of Medicare in 2025. Medicare is more than just insurance, it's peace of mind for millions. As healthcare costs rise, Medicare's role is more important than ever. It's a program built on the idea that everyone deserves access to care as they age. Whether you're approaching 65 or helping a loved one, understanding Medicare is key. We'll help you avoid confusion and make confident choices. Let's begin this journey to better health and security. Here's what you need to know about Medicare in 2025. Most people qualify for Medicare at age 65 if they're U.S. citizens or legal residents for at least 5 years. You or your spouse must have worked and paid Medicare taxes for at least 10 years to get premium-free Part A. If you don't meet the work requirement, you can still buy Part A by paying a monthly premium. Medicare isn't just for seniors. People under 65 with certain disabilities, end-stage renal disease, or ALS also qualify. If you've received Social Security disability benefits for 24 months, you're eligible. For ALS, you qualify the month your disability benefits start. If you're unsure about your eligibility, check with Social Security online, by phone or in person. Don't assume you qualify. Verify your status to avoid surprises. Knowing your eligibility helps you plan when and how to enroll. Missing key dates can lead to penalties or gaps in coverage. Be proactive. Check your eligibility early, especially as you approach 65. If you have questions, Social Security can help clarify your situation. Understanding these basics empowers you to make informed decisions. Eligibility rules can be complex, but getting them right is crucial. Take the time to confirm your status before your enrollment window opens. This step ensures you're ready to get the coverage you need. Don't risk penalties. Know your eligibility and act on time. Being informed now saves you trouble later. Medicare Part A is your hospital insurance covering inpatient hospital stays, semi-private rooms, meals, and nursing care. It also pays for drugs during your hospital stay, lab tests, and x-rays. Part A helps with major medical events that require hospital care. It covers short-term skilled nursing facility care after a qualifying hospital stay, at least 3 consecutive inpatient days. Skilled nursing is for recovery, not long-term custodial care. Hospice care is included for those with terminal illness, focusing on comfort and quality of life. Part A also covers some home health services like part-time skilled nursing or therapy if you're homebound. Most people don't pay a monthly premium for Part A if they or their spouse paid Medicare taxes. However, you'll face deductibles and co-insurance for hospital and skilled nursing stays. Understanding these costs helps you budget for care. Coverage is limited for long-term stays, so know the rules. Hospice and home health benefits can be a lifeline for families. Always check if your care qualifies under Medicare's guidelines. Knowing what's covered and what isn't prevents costly surprises. Review your benefits before a hospital stay or major procedure. Ask your provider if your care is covered by Part A. Being informed helps you use your hospital insurance wisely. Plan ahead to avoid unexpected bills. Medicare Part B covers medical services like doctor visits, outpatient care, and preventive screenings. It pays for services from primary care doctors, specialists, and other healthcare providers. Part B also covers outpatient hospital care, emergency room visits, and clinic services. Preventive care is a big benefit. Screenings for cancer, diabetes, heart disease, and annual wellness visits are often free if your provider accepts Medicare. Durable medical equipment like wheelchairs and walkers is covered if prescribed for home use. You usually pay 20% of the Medicare-approved amount after meeting your Part B deductible. Make sure your equipment supplier is enrolled in Medicare to avoid extra costs. Part B complements Part A, giving you broader coverage for everyday health needs. Understanding what's covered helps you get the care you need without overspending. Use preventive services to catch health issues early. Always check if your provider accepts Medicare assignment to minimize out-of-pocket costs. Review your coverage each year to stay up to date on benefits. Know your deductible and co-insurance amounts. If you need equipment, confirm coverage before you buy or rent. Part B is essential for managing ongoing health needs. Take advantage of its benefits to stay healthy. Being proactive with Part B can save you money and improve your care. Use your benefits wisely for the best results. Stay informed to make the most of your medical coverage. Medicare Part C or Medicare Advantage is offered by private insurers approved by Medicare. These plans bundle Part A and Part B and most include Part D prescription drug coverage. Medicare Advantage often adds extra benefits like vision, dental, hearing, and fitness programs. Plans must cover everything original Medicare does except hospice care. Types include HMOs, PPOs, and special needs plans, each with different rules and networks. Compare plans in your area. Check costs, covered drugs, and if your doctors are in-network. Look closely at premiums, co-pays, and out-of-pocket limits. Extra benefits vary, so choose what fits your needs. Research is key. Pick a plan that matches your lifestyle and health priorities. The right Medicare Advantage plan can offer more value and convenience. Medicare Part D covers outpatient prescription drugs through private plans approved by Medicare. It's optional, but if you lack other drug coverage, enrolling in Part D is important to avoid penalties. Each plan has a formulary, a list of covered drugs, which can vary widely. Check if your medications are covered and compare costs before enrolling. Plans group drugs into tiers. Lower tiers usually cost less. You can join, switch, or drop a Part D plan during annual open enrollment October 15th to December 7th. Missing your first chance to enroll can mean a permanent late penalty. Use the Medicare Plan Finder tool to compare plans and pharmacies in your area. Consider total costs, premiums, deductibles, and co-pays. Review your plan every year. Coverage and prices change. Using an in-network pharmacy usually saves money. Smart plan selection keeps your medication costs manageable. Some people are enrolled in Medicare automatically if they're already getting Social Security or Railroad retirement benefits. If not, you must sign up during your initial enrollment period, a 7-month window around your 65th birthday. Enroll early to avoid coverage gaps and penalties. Special enrollment periods let you sign up later if you have employer coverage. When that coverage ends, you have 8 months to enroll without penalty. Missed your window? The general enrollment period runs January 1st to March 31st, but late penalties may apply. Open enrollment each fall is for changing coverage, not for first-time Part B sign-ups. Know your deadlines to avoid costly mistakes. Mark your calendar and act on time for smooth Medicare enrollment. Most people don't pay a premium for Part A, but there are deductibles and co-insurance for hospital and skilled nursing stays. Part B has a monthly premium, which may be higher if your income is above a certain level. After the annual deductible, you pay 20% co-insurance for most Part B services. Original Medicare has no out-of-pocket maximum, so costs can add up. That's why many people get supplemental coverage like Medigap or choose Medicare Advantage. Medicare doesn't cover most long-term care, dental, vision, hearing aids, or cosmetic surgery. Prescription drug coverage, Part D, and Medigap policies have their own premiums and cost sharing. Review all your options to budget for premiums, deductibles, and co-pays. Know what's not covered so you can plan for extra expenses. Supplemental insurance can help fill the gaps. Compare plans to find the best fit for your needs and budget. Understanding costs now prevents surprises later. Smart planning keeps your healthcare affordable. Missing enrollment deadlines is a costly mistake. Late penalties can last a lifetime. Know your initial and special enrollment periods, especially if you're working past 65. Don't choose a plan without comparing options. Original Medicare, Medigap, and Medicare Advantage all have different rules and costs. Review your Part D or Advantage plan every year. Benefits and prices change. Use preventive services under Part B. They're often free and can catch problems early. Understand your plan's network rules to avoid high out-of-pocket costs. Read your Medicare, and you handbook each fall for updates. Plan ahead and do your research to avoid surprises. Free help is available. Contact your state health insurance assistance program for guidance. Stay informed and proactive to get the most from Medicare. Make decisions based on your health needs and budget. Medicare is complex, but learning the basics pays off. Take charge of your coverage for better health and peace of mind. Book your appointment today. We look forward to speaking with you.